surrounding medical marijuana in Arkansas and CBD oil. Dr. Kate Chandler from Cornerstone Clinic for Women is here to talk about whether they are safe to use while pregnant. Good morning to you.
Good morning.
And this is a topic that I think we have talked about before, but some new studies have come out. And so if you are pregnant or thinking about getting pregnant, you'll want to listen up.
Yes, so yeah, there was a study that was presented last week at a medical meeting, and it was printed in the Journal American Medical Association. It showed that, of course, marijuana use in pregnant women is on the rise. So, 10, 15 years ago it was about 3%, now it's about 7%, and this was a study done with about 500,000 women. So 1 in 14 reported using it, but few of them were saying that their doctors say they should use it, but they've used it thinking it would help with sleep or nausea, things like this.
So are you surprised now when you have a patient come in that says, I use CBD oil or medical or marijuana in general?
Well, I mean, I guess I'd say it's hard to be surprised about many things that we see, but I am surprised a lot of women may not know that's not a good idea. There's just not enough evidence to say it's safe. I think what happens when people know, oh, it's medical, it's approved for medical use now, or it's approved for recreational use. Well, just because it's been used for medical things like chronic pain or multiple sclerosis or spasticity doesn't mean it's safe. Just like, just because alcohol is legal doesn't mean pregnant women should be drinking alcohol. It's just there's some evidence that it might affect the baby's IQ later in life, their attention span. It doesn't allow their brain to develop normally because these THC could be hitting the receptors in the brain that are meant for something else to be hitting that.
Now, what about CBD oil? A lot of people say, well, that's safe, right? I can use that.
Yeah, well, CBD, I think it can be a great option because CBD has a lot of the benefits that marijuana could have, like affecting decreased inflammation, decreasing pain, maybe even decreasing. There's some studies looking at improving immune system, decreasing cancer. However, it's not been proven to be safe in pregnancy either, not with pregnancy or breastfeeding, because again, we don't know how it's affecting the brain development, and so we shouldn't be using it in pregnancy or with breastfeeding. And there's been evidence too that THC definitely crosses the into the breast milk. So yeah, I don't want to do that. Plus, here's the other thing is that CBD is not well regulated. So you have to be very careful of where you pick this up because it might have more THC in it than you know. And the other thing, this is a side note, but if somebody is using CBD, which again, I think there's some positives to it, if you're somebody who might be tested, like have to go through, if you are in work that you don't need to be doing anything that might
be any level in there.
You can have very strong issues, even though they may say there's none in it. A lot of them don't back up claims that, oh, we're going to back you up if your job says it's been found, because, well, plus you never know if there has been some other uses. But anyway, I just be very cautious about that.
Yeah, err on the side of caution, because these studies are still new, but we're seeing an increase in women, which surprises me as well. Pregnant women.
I just think we need just want to get the word out that even though it has been approved medical use and it's in some states recreational, it's not safe in pregnancy and breastfeeding.
All right, thank you, Dr. Chandler. We appreciate you. We look forward to your next topic as well.
Thank you. Okay.